the Medhaji moderating this session on intersecting the risk, the climate, women's health and well-being in rural India. So over to you, Medhaji, to take this discussion further.
My presentation? How much time do we have, Shamal?
We have till 3:30.
Thank you. Thank you very much, Shamal. Thank you, Lindy. I think enough has been said about why it is important to look at the intersect of climate and women's health, and I don't think we could have had a more august... You can't hear me? Okay. We couldn't have had a better panel here to have that conversation. Deepshika, to my extreme right, has been living, breathing, and researching climate and climate-related issues and works at the Population Council and has been doing some very interesting work. I can hear the echo myself. Is it better now? Yes. Okay. So that's Deepshika from Population Council and Kirti Iyengar here, Dr. Kirti Iyengar. And I've been reading, I've known Kirti in her various avatars as a researcher, as a co-founder of an organization, leading the SRHR portfolio at UNFPA, and now leading the SRHR portfolio at SIF. So she's sort of seen the whole cycle of implementing evidence-based programs, designing evidence-based programs and implementing them, to working at a multilateral, to bringing that vision and looking at it from a policy and programmatic lens, and now supporting organizations live that vision. So it couldn't be any better combination than that. And to my left is my dear friend, Nisha. Nisha brings to us two worlds. Having been an investment banker, having done her PhD from IIT and now living and breathing, working with adolescent girls and looking at the linkages of how we look at not just adolescent health from like a health perspective, but health, livelihoods, and looking at it from a global perspective. And they have a very immersive way of engaging, working with their partners for not 1 to 2 years, but really engaging deeply and working through partnerships of 10 years. So, absolutely inspiring ladies, and of course we have Shamal, who's done some really fabulous work when it comes to the research that they've put together, which I'm assuming people will get a copy of the report. Okay, it's online. All right, great. Being climate sensitive, it's online. And Shamal has been somebody I've worked very closely with as we've drafted something that is very close to TRIF's vision around taking services as close as possible to where women live with their families at the community level through what is envisioned as neighborhoods of care. And Shamal, I will come to you to talk about that. But we'll start this conversation with you, Deepshika. There is evidence, but there is very little evidence available on what it is to look at, when we say the linkage between climate and women's health. Right? We have started a lot of conversation and we hear a lot of conversation around climate resilience, but I feel it features a lot more around infrastructure, around the big and the mighty. But what really matters at the household level, and this was supposed to be an all-women panel, but you're welcome on it, Shamal. So if you could talk to us about evidence from the region, the South Asia region, and evidence from India around the impact of climate on women's health, on vulnerable communities, and why is there a need to build salience on this? Over to you, Deepshika.
Thanks, Medha, and thanks, Shamalji, for inviting as well. I would like to read this particular edition, and thanks everyone for joining us today. Just giving a brief little bit about what Population Council does. We basically work a lot in research. Of course, our work started pioneer work under our biomedical research unit on family planning, but then we moved to other policy engagements and a lot of ground research. And we started the intersections, basically looking at the intersection of climate change, women health, and others, 10 years ago, we started doing research, not only in India or South Asia, but across the globe. What we found very, of course, very, very astonishing and surprising and shocking results were that all of us are aware of the harmful impacts of environmental degradation, climate change on human health, but particularly on the vulnerable groups and how especially, maternal care and vulnerable communities are actually impacted and the response. So I can quote like from some of our research and might be helpful to know the numbers. So a large-scale study we did, and this is specifically, so we have done studies across groundwater contamination, seawater contamination, saline waters. We have done on air pollution. And in India, one of the studies on air pollution and women's reproductive health, which was a large scale across 184 Indian cities. And it was revealed that even a 10 microgram per meter cube increase in the PM10 levels, which is the air quality parameter, and we talk about it all the time, it significantly raises health risks for pregnant women as well as the newborns. And there are severe impact. It can increase in neonatal mortality, premature births, and impacting, of course, the woman health as well. Similarly, we did a study, which I would like to quote here, is on Bangladesh as well, and also in some of the Indian cities, on saline water intrusion. Again, we found that, especially after, we all know that one of the major change is on the sea level rise due to the climate change. And sea level rise in vulnerable communities across the coastline is impacting them humongously. There is a seawater intrusion, that's a backlash of the water when it comes in. It's a physical phenomena which happens. It is very natural because of the deviation between the slope, and these are all physical parameters. And then these water is usually used for drinking purpose, cooking purpose, and everything. And it has severe impact on women's health. We have seen that the preeclampsia cases have risen because of these things. So there is evidence. However, like you said, we have seen a lot of research and advancement in climate change, which is primarily on the sides of mitigation. Recently, the adaptation has been brought into the picture, where all these softer intersections have also been, now we are talking about it. First time we are developing adaptation plans on health across the globe and in India as well. Still, I see that specific focus on, especially on maternal health, women health, is missing. So there is a lot to do. Another thing is that though there are evidences that this is the impact, however, there is a need to build more evidence. And I see the role of a lot of civil society organizations to help us doing that from the ground. So yeah, that is what I would like to want for. Thank you.
Thank you so much, Deepshikha, to bring us to the point that we need to be as pointed and as specific when it comes to implementing programs to be able to do that. And oftentimes when I'm conversing with, whether it's colleagues at TRI, if I see Indrajit in the audience, when we're looking at programs that PCI and other organizations are implementing, the question is, karna kya hai? How we know that air quality, heat, it's impacting not just pregnant women. We tend to just look at women as pregnant women. It's impacting girls, women, boys, and men in various ways, right? But what is it that we do to improve health outcomes? We don't know that. What time should the heat exposure be minimized, both for men and boys, as for girls and men, girls and women? Like you said, air pollution. I read this paper around salinity in Bangladesh, which you said was leading to increased complications during pregnancy. But globally, research is showing us that there is more research on fetal outcome as compared to care during pregnancy. Yet another reminder to us that what is prioritized and what is not. But I can keep talking about research, but I'll come to you on that. Kirti, you've been a researcher, but I'm not going to go down the research route. When you look at it from a micro and a macro perspective, and you look at climate, the impact of climate on women's health, and specifically sexual and reproductive health and rights, look at it from both girls and women and boys and men. we're seeing impact across multiple dimensions, as I was mentioning. How could we be more inclusive in our approach and not just look at silos? That today we're only looking at pregnant women, tomorrow we're only looking at men, we have interventions only for girls. How do we create a more inclusive approach?
Thanks Medha, and thanks Shyamalji for inviting me. I think this is a very inspiring place to be in, and it was great to hear the evidence from you, Deepshikha. So I think any intervention on climate and health, and climate and women's health, cannot be in silo, because if you look at any issue and how any of the climate impact, for example, water scarcity, it impacts women. They have to travel more, like somebody mentioned about they need to fetch water. So we do need several interventions from the Ministry of Water Resource or Jal Shakti to water harvesting, climate resilient infrastructure, etc. However, on the health front as well, we need to have, for example, safe water in health facilities. And safe drinking water at home is one of the biggest things which prevents women, so much of burden, as well as reduces the burden of diseases, including the waterborne diseases. And similarly, if you talk of food scarcity, again there is a role for various ministries like agriculture, but also the health needs to do better nutrition screening, supplementation program for women, and of course children as well. And similarly, there are so many other interventions such as the heat, the rise in temperatures. So of course there are interventions to be taken by Ministry of Environment and Climate Change, but also we need to see from the health side as to can we have health worker training on how to treat the heat illnesses. Right now, no ANM, like that is what I'm estimating, that most of the ANMs would not know how to treat heat stroke, and ASHAs would not know what advice to give on that. And in smaller health facilities such as PHCs, there need to be emergency cooling resources. And coming to think of it, of course, the vector-borne diseases also, better management of vector-borne diseases at all levels is needed. But at the same time, we also need to think that, okay, like in-service trainings are fine, but do we need to build them in the pre-service curricula of doctors, nurses, and various other cadres of health? Do we need additional sort of modules on climate and health, or everything that is related to climate? So there are like of course, we all of us are quite familiar with what interventions are needed for displaced settings, and how the maternal child health services as well as the SRHR and menstrual hygiene, etc. needs to improve, and GBV prevention, etc. We know that. And so one of the other thoughts that I have is that while health will, like various ministries and health have a huge role to play, and as well as the civil society, we also need to see what can we do with self-care. There is a lot of talk of self-care. Now climate is an area where people are not really sure what does it mean to have self-care. Can people decide on their own what kind of, on their own, or through the support from civil society as to how can they do some techniques to keep their houses cool, or to, what kind of other mechanisms can they have to deal with some of these approaches. I would stop here.
Kirti, building on your point around self-care and having worked in sexual and reproductive health and rights for as long as I have, I think it's very important for us to also look at ways and means whereby women and girls and boys and men are able to take the decisions that they want, and the health system is able to support them, whether it is contraceptive choices, care during pregnancy, management of pregnancy, whether they want to continue the pregnancy, safe abortion services. There is so much that is available in this global literature on how we can make health simpler. We tend to, however, still think of health in silos of physical health, mental health, preventive health, diagnosis, treatment. We'll come to that. You've given me enough food for thought. And of course, you've talked about GBV also. I'm going to come to that. Nisha. So I'm going to ask you to zoom us out a little. you've had the experience of working with communities not just in rural India, but also in very many parts of the world. And I'm sure that there are a lot of similarities and there are a lot of differences. But if you're able to talk to us around what global evidence is available, and through your work at Empower, of how you work so immersively with groups and you have different thematic areas in different countries, what could be some immediate linkages between climate and women's health? And are there some examples? Since we are talking about, what is it that we can immediately do and run with? And every time I say immediately do and run with, I see a lot of eyes light up in the audience कि हमें बता दो हमें क्या करना है और हम उसको program में include कर लेंगे. So if there are some insights you can offer on that, would be lovely.
So I don't know if I can offer any insights because the expertise is actually not on the panel, but it's in the room in terms of, ground par kya karna chahiye. We should be listening to you, not the other way around. But I'm going to start by being very provocative, as I often am. Several of us might have heard the statement that poverty is sexist. And I want to say very similarly, climate change or the effects of climate change are sexist too. And what I mean by that is climate change shows up, the effects of climate change shows up very, very differently in the daily health, both physical and mental, and the lives of women and girls. It's not even like a parallel concept. I would go as far as saying is the effects or the reeling effects of adverse climate moments upon women and girls. It's like it's in a different orbit. And I think keeping that in mind at the center of our interventions, at the center of our programming, at the center of our program design is critical. So I'm going to begin where I end, which is that one of my pet peeves, and I've been working on gender justice issues for many, many years. One of my biggest pet peeves is when you say, we have a women's empowerment vertical. What does that mean, right? What does that actually mean? What we need to be thinking of is women's empowerment as a horizontal. And very similarly, I guess the first thing that I would say, this is what I can offer to all of the wisdom in the room, is wo galtiyan hमें करनी नहीं चाहिए climate change के साथ, right? We have to start viewing climate change or climate action as a throughput to everything that we do. So the intersection of climate and livelihoods, the intersection of climate and sexual and reproductive health, the intersection of climate and education, as opposed to saying, this is our parallel. And I think both the lens of gender and the lens of climate change should walk hand in hand. And why is that, right? Because the global evidence is very clear. So there was both in terms of biological realities as well as social realities, right? The actual social structural barriers that women carry each and every day, right? I think the video that we saw, it's like, I think I'm going to quote this and it's stuck in my head forever, is the number of paintings we see of women with matkas on their head, but not once have we seen a man, right? And not once have we considered what that's doing physically and mentally to her body. So we know that women carry the burden of adverse climate change. And an analysis of over 130 studies found that women are more likely to suffer health impacts as a result of climate change, more likely to die or be injured during extreme weather. After a climate disaster, risks go up, not just from the actual event itself, but from the aftermath, whether it's heat stress, unsafe waters, pregnancy complications, and increased gender-based violence. So let's make this real for a second. Imagine you're a 16-year-old girl living in rural Rajasthan. This is several of the communities that we work in at Empower. Your family depends on farming, and a drought wipes out the crop. I believe it was a year or two ago that was a severe drought, 2 years ago now, it was a severe drought year. And suddenly your school shuts. Your school fees, even for the ones that are open, your school fees are a stretch. You're kept home to fetch water, which now means walking for hours and hours in the heat. The stress on your physical body is real. you're more exposed to harassment as you're walking further and further away from water. The increased violence you experience in your home because there is no money. So what happens in times of stress is violence is increased and it is perpetuated. And the little food that does come into the house is offered to your brother and your fathers first, and you eat last. And that one climate shock, that one drought has affected your life in every single way possible. But there's another side to this story, which is when we look at climate change from a gendered lens and we link the two together. So in Southeast Asia and Vietnam, actually, we have an example of one of our local partners that trains women in the green job space while also comprehensively providing sexual and reproductive health programming. So if I was to offer a solution, that would be it, right? Is how can you advance climate action within your own communities by also comprehensively building an ecosystem of support around the women and girls that you're working with, so that they have access to self-confidence, self-efficacy, their SRHR, their goals, their aspirations, and then also freedom from violence. So the lesson from all of this is we can't just focus on health and we can't just focus on climate, because to a 14-year-old girl, in a rural environment, in the communities that you work in, those two things are inseparable. So we have to stop, as practitioners, as policymakers, we have to stop forging them as separate binaries. So I'll stop there.
I'm always left speechless after you speak, Nisha. The one point that I additionally took from your intervention is that we're constantly looking at the direct impact of climate on individual and community lives. There are so many indirect impacts which we're going to start to see. Some we're already seeing and some we're going to start to see. Gender-based violence is something that all three of you have alluded to. Increase in sexually transmitted infections, unemployment, overall increase in violence, all of these things are things that we're starting to see. And unless we make that connect of climate, health, livelihoods, education, and look at it in a circular way, and maybe food for thought for you to have more research, and as you think of strategies where you're working with partners for funding and supporting new initiatives, how are we able to look at it as a continuum is something that would be very useful. But what you said, Nisha, nudges me along to Shamal, and on a piece that Shamal has envisioned and worked on, which I think is a very, very beautiful piece of work, but it doesn't fall into any classical category, right? So Shamal, हम लोग जब बात करते हैं समुदाय के लेवल पे, हम बात करते हैं कि हमें महिलाओं के साथ काम करना है, तो महिलाएं, जैसे निशा बोल रही थी, आइसोलेशन में तो कहीं रहती नहीं है, राइट? इट इज़ ऑलवेज अबाउट the ecosystem, so the individual, the family, the community, and our communities play a very strong role in supporting us to become who we are. So this model of neighborhood of care that you've envisioned and that TRI has designed, and that hopefully someday there will be funding available to be able to take that forward. And I can see Andre also in the audience, who's been talking about neighborhoods of care, not just in India, but in the US and in various other parts of the world, would be very helpful for you to help us understand what is the role of the community and how that seamless linkage is very important in terms of what people can do for themselves.
So thank you very much. I was not supposed to sit here in the panel. It's supposed to be a only women panels. Anyway, I have came into it. So thank you very much for this opportunity. See, first that if I look into a lived reality of the climate change and the scenario how it affects, you just imagine in a flood-prone area, a woman who is pregnant and going to deliver, and is due to the flood, she is living in a rooftop for 15 days. How we will be designing any program, how fantastic facilities we might have, how it will be reaching to the woman and how it will be helpful. So that's the point it comes, that it is not the drug, it is not about diagnostics, it's not about doctors, it's not about disease. It's about celebration of life, and it is about celebration of life happened at home, and it is cherished, supported, and takes forward for millions of years by the families, kinship, and the social network in which we live. And that's is about health. And that's we exactly tell when we talk about neighborhood of care, that putting a woman into the center, or anybody's person is in center, that how our family, kinship, and the surrounding places is helping us. And that's why we are envisaging it, that and in this scenario, each one of us are caregiver, each one of us a care receiver. That's the basic principles which we every day follows. And if we look at it in a very simple thing, and the way human, and we are all flourished, that it is that self, and it is within the family, at the home, at the habitations with whom we are actually living. At that scenario which I have already shared with you, is a lived reality for many of the places in Bengal, Odisha, Bihar. I had lived few years in Assam also. So these places, this is the lived reality. And who is the first respondent? This is the first respondent is the nearest, the neighborhoods and the nearby places. And if the next round would be coming the nearest health facilities. So how we'll be empowering, helping, and redesigning, co-designing our entire thinking. That how we'll be redesigning, and that's the work of today. And we have to rethink that how it has to be done. So that's we are looking at a neighborhood of care.
Thank you. Thank you very much, Shamal. And I think that is a lot of food for thought for all of us, because we tend to look at things in silos. But there can be multiple departments. But eventually it all converges down to that family and all of the programs that they need. And the role that women's collaboratives play at the community level is quite incredible in doing that. So I had a rather heavyweight question for you, which I had planned. But if you'll allow me to deviate from the script, I have to pick on what Shamal had said, which is around the concept of happiness. Right? When we talk about health, and as you were pointing out, Kirti, we get into that very classical division of here is a health facility, here is a healthcare provider, these providers are trained to provide this service, these providers are trained to provide this diagnostic. So we have that whole mapping charted out. But there are also journeys of people which are not just physical or mental, right? And when we are looking at health, we're not necessarily looking at only absence of disease. And climate changes are leading to a lot of changes which people are not even perceiving. Like, diseases are not presenting in classical patterns. So it's very confusing. It's very stressful. It is leading to a lot of emotional drain also on people. So you can kill me if you want, Deepshikha, putting you on the spot here. But, when we look at the indirect impacts of climate, how can we start to build evidence which is more person-inclusive, which is not vertical-based? And I'm going to come to you after this to look at the connection between women's health, livelihood, and education, why it's important to look at it increasingly in light of climate. So I'm giving you a heads up. But Deepshikha, how can we build evidence? I struggle to find even actionable evidence on impact of climate on improving fetal outcomes or improving adolescent boys' health, right? I struggle to find that. So I'm asking you for a macro picture, but would be lovely if you can help us.
Thanks. So it's fine, you can deviate from the script. That is also welcome, always as well. I think it's a harsh reality that we cannot do everything together also, and we can also not do everything in silo. So we have to find a middle path where all of us can connect, because ultimately there are many things which are playing around. There's governance, there is, like you were talking about capacity building and others. There are, in research also, what we have been doing for past many decades is that finding the direct impacts of climate change and disasters. And therefore we have been focusing on mitigation, access to water, access to clean water, access to 24/7 water, access to energy, now energy, we want to move away from coal, we want to go into renewables. Considering the population we have, considering the size, the country size we are, and South Asia we see, it's very difficult to achieve the renewable targets. It's not easy, first of all. So access, and we are actually quite ahead in that aspect. So now we are moving towards adaptation and building resilience. Now when we talk about now again, the evidence needs to be created and generated, and it has to come from the ground. It cannot be done, I'm doing my desktop research to get the macro picture, I know that already. What we need to do is we need to actually do those evidence generation in the ground. What Shyamalji was saying is very good. Till now I was usually used to talk about human-centric approach, people-centric, but it's life-centric. Right? So we are not only touching upon human life, we are also touching upon the biomes. We are also touching upon the habitat. We are also touching upon simple water, like groundwater. Are we keeping it clean? And what you touched upon, like, the capacity building or training of people. So in terms of indirect impact, I'll again come on that, is that there are huge indirect impacts which we have not been able to, capture. As simple as that, there are many research where I was talking to you about dengue, one of the cases, like after dengue, which has now increased in mountain areas, mountain states of India. It is increasing every year, the cases. And actually, the people are not aware that it caused severe impact on their mental health. That's a fact, but the kind of knowledge dissemination has not happened. And think if it is happening with an adolescent. Think if it is happening with the college going children. If it is happening with the vulnerable community. We have seen a lot of cases increased in the GBVs and others. People are not even able to relate to these issues, the well-being. This year has been quite great that we have received good rainfall. So of course the air quality in Delhi is better, but on the other side, we face everyday trouble of getting stuck in traffic, which we don't want, right? So we are kind of happy that we are getting a good air quality, but on the other side, we are not that happy, we are in stress. We don't relate to those stresses in everyday life. So these things has to be done at the ground, and we cannot have a blanket kind of approach. That, okay, this is a proven concept somewhere, and it has to be same. So even if you see the policies we have, some of the policies for I would say the flatlands, we apply the same to the mountain regions, where we have to co-create them, we co-design and adapt to the local conditions. And I really like the thing of life. So every biome is different, every life is different, every community, and even every ecosystem of environment is different. So on that, thank you.
Thank you. That was very insightful. And that's taking me back to the video that Lindy had very nicely shown us. And there was a point in that, Lindy, where the speaker was talking about the damage. She didn't use the word damage, but the damage that I'm using that word second time, sorry about that, on access to tap water, and how it has changed our perceptions of water. And we talk about heat and water. We have a house in the hills, and sometimes we tend to go there. And in summers, we don't get water supply in our house, and I feel, are superbly entitled. Although our house is in a very small village, and it's hard for them because we have the ability to buy water. But the local community, they can't buy the water. So in summers, water comes once in 15 days. So locals have to have storage for 15 days. And in better weather, it comes twice a month. Okay, so it's not like it changes. In rains, it gets even harder. So to get drinking water, we have to go to the village Baudi to fill water. And that is a task that my 13-year-old does. And the value of walking 2 kilometers, and she's exactly calculated, it's not 2.5, it's some 220 or something kilometers, carrying 6 liters of water, bringing it back home, and the preciousness of that water matters. So we talk about heat, but the vulnerability of the mountains is also huge, and the challenges that women face in those places is quite incredible. the resilience that women build, I think that is something that we take for granted very often. But Kirti, when we talk about the need for prioritizing additional research, understanding, we will keep understanding, but women, men, they're continuing to live their lives and they're continuing to face the challenges. So are there things that you suggest that we can do immediately as we are building on this evidence, and how can we get support, which is in the form of money and intellectual resources to be able to build those resources, but also strengthen programs on the go? Very tough question, sorry.
No, I think because all the others, especially Shamalji's point was so, I think, up to the point to talk about this, what can we do immediately. So, of course, we know that some of the things that we need to do is to compile the available data, which is not, unfortunately, synthesized in one place, which we can take to someone who can build better programs, more integrated programs, that we need to talk. Okay, so that needs to happen, that we need to take that gender disaggregated data. Yes. We need to integrate the system for gender disaggregated data in all health, like not only health, in all programs, health, agriculture, environment, every program, so that we know what is the impact of climate change on various born men and women, and we use the data more powerfully. So I think that is one of the levers that we should be trying to do, synthesizing the data that is available, not really trying to get into additional research. So that is of course one. Some of the things which are aligned to the self-care concept or the neighborhood of care concept is that we need to see what is happening, and how can we highlight the solutions which are already being tried out, the community-led or women-led solutions, and how can we take them to someone who will be able to scale it up, whether it is a of course it will be government, who will be able to scale up those solutions, and in some cases maybe civil society as well. So, and in terms of long term, of course, you wanted me to talk about the immediate, but still long term, I'm tempted to say that we need to, because SDG is something that is like everybody wants to see what is the impact on SDGs, universal health coverage. So we need to also demonstrate that unless we achieve some of these goals, unless we tackle some of these issues, we will not be able to achieve SDGs and universal health coverage. So I would stop here,
Thank you so much. So Shamal, clearly you're emerging as the star of the panel, but I'm going to pose my next question to Nisha. Nisha, we've been talking about how Shamal has framed it in terms of looking at it from life, and life is about an individual within the context of family, and you already alluded to the linkages with education, livelihoods, health. Can you talk a little more about how do we make that cross-sectionality happen, because they're so verticalized, and we in the development sector are so used to programs and ministries and departments, but people live different lives. So how do you think we can create an opportunity where it's not meeting at a right angle, but it's more enmeshed?
Thank you so much. Pardon? My favorite question, absolutely. And it's one of my favorite questions because I can share a little bit more about what we do at Empower. So first of all, I'm going to start with measurement, because I don't know if everyone loves it as much as I do. I absolutely love it. But we don't actually view our impact in a silo. So we're not counting beneficiaries. We hate the name beneficiary. We say program participant instead of actually using that term. But I think more importantly, and this really speaks to what you were saying, is centering the individual. So for us, the individual is at the center. Most often, it is an adolescent girl who is at the center for us. And then we look at 2 or 3 other planes, which we actually measure, right? So the second is the organization. So CBOs such as yourselves, right? What is the impact of the organization upon the girl, but also of the program upon the organization, right? And the third frame of analysis for us is the community as a whole. So it is mums and dads and duty bearers and religious leaders. We are measuring at all three levels. So level of change in the lives of an individual, level of change in the lives of the organization, and level of change in the lives of a community. Because our beating heart is the fact that you cannot work with a young person in isolation. Right? You have to work with the duty bearers and the adults in her life. You have to work with the communities in her life, because the burden of change cannot be placed on a young person, and she can't be told, go live your best life. You can do anything. We will empower you. But if your family and your community is not empowered, you're not going very far. Right? Even if you have the dream to run a marathon, if somebody's holding the pallu of your sari so tightly, how far are you going to actually go? Right? So that is why we always assume an ecosystem approach in everything that we do. And I think similarly, this framing of climate change, SRHR, and livelihoods, why it's my favorite conversation is because, what the evidence says, and I think you all know this better than I do, what the evidence says is for an SRHR program to be successful, the natural progression of an SRHR program is a livelihood one. And very similarly, and I wish we had the data for it, but one day we will, and it'll be amazing, is I think climate change needs to be viewed in that lens, right? Is when we think about planning programs and interventions on the ground, and I think honestly, several of you are probably already doing it. My only advice to you is name it. Name it, because you're already doing it. I'm sure you're doing it, because the wisdom that all of you have is recognizes the ecosystem, recognizes the individual at the forefront. So the sort of naming of it is really to bring together agency of women and girls with their SRHR needs and their livelihoods. With SRHR and livelihoods and with climate change. And where the three circles intersect, the center of that Venn diagram should be your program. One that touches upon the entirety of a woman or girl's life cycle, and has considerations of her sexual and reproductive health right needs, the impacts that of climate change, as the impacts of livelihoods, and importantly, her agency. Okay, so I'm going to be very quick to go through this by saying, when we talk about agency, we know that, I just use the trope of the girl's sari being held back or her dupatta being held back, right? The first step in this interlocking circle is to make sure she has the ability to unleash herself from the hand that holds her back, but also the hand itself should stop holding her in the first place. The second thing is, when we think about climate change, I want everybody in the room to actually do this. I want you to close your eyes for a second and think about a climate change hero in your life or in the news, somebody that you know who has been on the forefront of climate change. Okay, now, how many of you thought of a woman? Put up your hand. Yeah. And if I'd asked you this question about technology, there would be far fewer hands in the room, right? So women and climate change have been irrevocably linked, and that's amazing. But the burden of change for climate action cannot also be disproportionately placed on women. So when we think about programmatic interventions, are you, in your interventions in your community, placing the burden of change on women and girls, or are you involving the community around her? Okay? And then the third thing is, when we think about the third Venn diagram, the third circle of the Venn diagram is livelihoods, right? Very often we frame livelihoods in these discussions as a loss of livelihoods for women and girls, because very often the loss of livelihoods is a result of her working in the primary sector, right? Because she is in veterinary science, or because she is in the fields and she is actually doing weeding in the field. So first of all, she's at the very end of the supply chain, right? She's the furthest away from market, because the men are taking, like I'm Punjabi, and in Punjab they say ki aurtein hal nahi chalati, right? Why not? Because the second you hal chalate hain, to fasal katti hai, and the second the fasal is cut out, you take it to market, right? So women always do the work that is furthest away from the market, right? And very often in climate events, that women are the first to lose their livelihood. What I would suggest is a reframing, is there's this whole world that is out there, is what is the world that we can experience when women are engaged in green jobs, right? And we're seeing this, so a lot of our livelihoods programming is focusing on women in non-traditional climate livelihoods, focusing on solar, focusing on green energy, focusing on renewables, focusing on driving cars that are green. So I think it's a conceptualization of all three, but it's also the recognition that we can't separate the three, but we need to reframe all three so that we are being progressive and feminist and inclusive.
I think that calls for a round of applause. That was absolutely incredible. Shamal, I'm very tempted to ask you a question, which is taking this further around linking women and the role of women's collectives and livelihoods, and how that plays a very positive role. But I'm going to leave you with that thought, and I'm hoping that nobody in the audience has questions so that I can actually ask you that question. But do we have any questions in the... I have all of these questions already. Oh my God. Oh my God. We have 10 minutes. Lady, okay, sure. Well, sorry. So we're not getting to you on that question because there are lots of questions that have come. And wow, okay. It'll be nice to see who's asked the question. Will we get to see who's asked that question or no? Okay, I'll ask the question and then you can just raise your hand and show us who you are. And I'm going to need my reading glasses, God save me. Yes, you're younger.
People can just ask if...
Building evidence is one thing. How are we changing imaginations and resolve? Can we change the image of a farmer, of a mustache man, so that our starting point for solution design is representative?
Whose question is that? Ah, Harpreet, thank you. Please.
So yeah, I completely agree with you, but just a thought process. And again, just a question to that, which ecosystem are you imagining when you're imagining a male farmer only? So if you go to mountains and you go to other places and rural areas where, most of the men have moved out, there are abandoned villages and all, it's mainly women who is taking care of the agricultural activities. So it's very difficult, but yes, I do agree. So for that, we already have a lot of data. We need to act upon it. We need to start working on not only on the policies, but also implementing the solutions. We need to work on technology, increasing the capabilities. Recently, what we did was one of our studies, although it is not from India, it is for Bhutan we did. We did a kind of developed, and it is a research which we did, which was an uptake for the government of Bhutan. So we did a policy, and it was a very simple research. We did a multi-criteria assessment framework. We have looked basically looking into RE, powered lift irrigation systems in Bhutan, from GESI perspective, from financials. We were looking at the whole value chain. So there are things, not only so there is an implementation science also, not the core research, I would say. Thank you. We can also have bilateral discussion.
Harpreet, I would like to answer that question, and I think a very wonderful framing that I see to that shift is in school textbooks. Last year, when my daughter was studying and I happened to flip through her book, there was a fabulous visual which said 63% of farmers in our country are women. So it had an image of a woman farmer, and I think when children are growing up and they are provided with that framing which is moving away, so their textbook, there was probably 1 or 2 pictures of male farmers, but most of the pictures are of women farmers. So I think that's a very conscious effort of building into children's mindsets, and this is CBSE textbook, so it's a very incredible change, I think. And these are the small kind of changes to the aspect of what you were saying, pre-service training. This is really in school education when we're starting to bring in this gendered dimension, a conscious effort where it is not always the mother making the roti. Every TV ad may have that. But those kind of images are changing in textbooks. There's a lot that's changing in textbooks, which is probably not great, but there is a lot which is absolutely amazing. And I think we need to appreciate and acknowledge that. All right. Yes, so there is another question, and I have found the right distance to be able to read it. Climate and health focusing on post-climate change impact, adaptation, and building resilience. But how are climate solutions impacting women? For example, we move away from coal, we need gendered lens for reskilling, for re-employment. Whose question is that? I don't know, okay. Because it would help to understand that a little more. My sense is we're talking about how the traditional professions are evolving and where could there be more opportunities. You want to take that, Deepshika? Go for it.
I can take it too.
No, I think, again, it's a very good question. What we need to do... yeah. So I think most of us have heard about just transition. So, for example, now specifically somebody picked on coal. So there is what we are looking at, and the government is also looking at, is just energy transition. So we have to look into that. We also need to see how we can bring in the aspect of the climate insurances. That has also started happening at a very, very nascent initial stages, especially when GRAP is happening in Delhi. So similar kind of things needs to evolve further. We have to work closely to bring those solutions also in forefront for people to actually uptake them together. And that is, I think it's good to have those discussions. Thanks.
I think that might be my favorite question, so thank you. I think the framing is twofold, okay? One is, where do women already exist? So I'm gonna actually reuse the agriculture example. Women have always worked in agriculture, okay? Simply. And our photos and our representation need to look like this. We know this, right? But it's also their position in the agricultural value chain, right? So where are women positioned right now? I promise you, think of an example in your head. The work that she is doing is furthest away from money. Furthest in terms of time, because she is sowing a seed that is going to be a plant, that is going to be cut, and that will go to market 10 months from now, right? Or she is doing home-based work in the home that will eventually go from one hand to the next hand to the next and eventually be sold to the market. So I think not only is it about female labor force participation, but it's actually recognizing her space and her role in the value chain and moving her closer to market. So that's one. The second is non-traditional livelihoods, right? Which is why I said it's my favorite topic, because it's my topic of research, right? But it's actually reimagining what women can do. So one is where they already are, let's move them to market. And two, it's let's be disruptive and let's blow open the doors and reimagine the sorts of work that women can do, right? I said earlier, ki Punjab mein aurtein hal nahi chalati. Let's contest that. Right? And there are schemes, right, like drone didis and all of these that are now emerging, right? Like, what are the spaces and places within the rural livelihoods infrastructure that are either not yet gendered or are low-hanging enough fruit for women and girls to enter into meaningfully and be remunerated as the same level as men?
Thanks, Nisha. And you know, in some of the field visits that thankfully I've done with TRI, one thing that I learned very beautifully from them was not just their work with women's collaboratives, but also building markets and, you know, blending those engagements. But despite that, the honesty that they have always shared is that women's collaboratives will be producing fabulous products, but the market just doesn't support. And I had a personal, you know, experience. I wanted, I don't know how many, some hundreds of kgs of khad for my terrace garden, and to support a friend of mine who does a lot of organic farming. but we were just not able to get the supply chain working and the transportation figured out to be able to make it cost effective, and that completely broke my heart. And those are barriers. Women can do everything, men can do everything, but it's about how there are barriers that exist. And once I was asked a question by a very senior officer, and this was around a conversation around contraception and World Population Day, that but why do you want to delay first pregnancy? Because what is it that women are going to do? Because there aren't any jobs for women. And I think that was a brilliant question. I'm very grateful to that person for asking me that question, because that helps us realize that there is still this thinking of jobs for women, jobs for men, jobs for girls, jobs for boys. And till the time we don't transcend that barrier, we will be talking to ourselves about this power language, but there's a lot to be broken. There is one question for you, Shamal, and with that, I will bring us to a close with each of you giving one word. I can speak for as long as I want. You get one word to say, what are you taking away from this panel? Yeah? Shamal, the question for you is, and I have my chashma now. We talk about children, we talk about newborns, we talk about pregnant women. What is the role of elderly women and how can we support? And I think your whole concept of neighborhood of care covers that very beautifully. So 30 seconds.
Yeah. So first, before that, I just want to highlight one thing, that the latest SRS report, it has brought a very beautiful thing. I don't know whether it's beautiful or it is striking. The thing is that there is a state in India where the maternal death is very low. It has achieved better than the national average. The children mortality is very low, better than national average. But in the same state, the woman has the life expectancy, overall life expectancy, lower than the men. Also, the differentiate between the lowest livability index, if we look in India, say Chhattisgarh and Kerala, the differentiate is about 15 years. So what it strikes me, it shows that our singular focus into maternal child health and success into the life stages at the very early days, we may achieve some of the indicators. But the overall life, if we see, we have to do many of things. And I think that has linked to your these questions. That the another study with Niti Aayog, it shows that if once, as the people are living more, above 50 years, when that report is available, it shows that people actually don't want to live. They have the lowest level of life satisfaction. So it means that although we are improving the life with various medical interventions, the quality of life and enjoyment of life, that's I was shared with earlier, that is the celebration of life. So we have to think there. And if we look about celebration of life, in our entire culture and everything, our older people or our seniors play a very critical role. So the future is about silver. So although I'm, so we have to look that side.
So your takeaway word is silver. Okay,
yeah.
Nisha.
Oh gosh, I think it's hope.
Hope, okay. For me, it's climate and community.
I think
I said there's no limit on me. Moderator's privilege. One word.
I think it is ambition.
Ambition.
Yeah, for me, it's collaboration.
Fabulous.